because I think it really represents what SET is all about, which is live classes, talking to people, engaging with people. So, guys, you might see something on your screen saying you're live on YouTube. Don't worry, it's just 10 minutes, 15 minutes, okay? Let's get started. Here we go. I'm starting the class now. Okay, so this is OET speaking. It's what we call an input session today. So we're not going to do any practice really with speaking. We're just trying to understand what is information gathering. What do OET want to sort of see you doing in a good way? And then tomorrow you'll be practicing that in groups with Lawrence. And then Wednesday and Thursday you'll be practicing these things. On Friday we'll have performances. So we'll split the doctors and the nurses into two groups, and some nurses, some doctors can perform, and we can think about, are they doing this information gathering? Okay, so that's the plan this week. If you're new, can everyone see my screen? Does everyone see like 1, 2, 3 here? Does everyone see this?
Yes.
Fantastic. So you know the score, Carmen. This is my routine. So we'll start off, guys, and we'll talk about what is it? What is information gathering? Then I'm going to make a sort of diagram, and it's going to be a simple diagram that you can sort of learn if you want. You can memorize the phrases and practice using them. Finally, at the end of the class, we'll talk about common errors and mistakes to avoid. Of course, I've been teaching OET a long time. There's lots of things that people always do, and I would like you guys to try not to do those things. Try to avoid the common errors, the common mistakes. Okay, so let's get started. Let's start with Carmen. It's nice to see you, Carmen. I hope you're well. Can you tell us what is information gathering, please? What is it?
It's a criteria, and it
Okay,
means that
let's stop there because people don't always give me such a good answer. Actually, often they start telling me what it is, but really it's a criteria, isn't it? So what does that mean, Carmen?
it's one of the things that we have to do, and the criteria means the scoring system that OET uses for us
So guys,
to
this is the
grade our
scoring system.
performances.
And I like this thing you said. It's one of the things we have to do. One of the
Yeah.
things we have to do. So it's something we're doing. It's a sort of technique or a method, information giving. That's the first thing. Let me ask Metap, though, or
Yes,
Osman. What do the words actually mean, information and then giving? What does that mean to you, Osman?
it's provide the information to patients.
Right. I like that. So in to give is to provide in this sense. Yeah. And then information to provide. What does information mean, guys? What is information? Anyone?
Knowledge. No,
Data.
Knowledge, data. We could say data, knowledge. I think maybe details. Or how about explanation? Explanation might be something like this. To provide an explanation to people. Okay, we're giving information. We're providing information. I'll just put information here. Okay, so it's quite simple. Let's have an example though. Vlad, could you give us an example of this?
Okay.
How we do it?
So I would like now to talk about medication that you should have. This is paracetamol. You should have it twice a day, and and if you have headaches, for example, you need to take two of them.
Okay, so did everyone hear what he's saying here? Well, what's he doing? What's Vlad doing here, guys? I would like now to. What's he actually doing, guys?
It makes more clear for us, maybe. No, no, I'm
Uh,
wrong.
yes, he's making more clear. Vlad, what were you doing there? Sorry.
Well,
more of
I
explanation.
not signposting, but yeah. Oh, I was told that we would talk about medication, so yeah, I tried to made a theme about yeah,
So he tried to sort of make a theme about it to try to sort of signpost it, I guess.
signposting. Yeah.
Yeah. Okay. So guys, this is what we're kind of talking about here. I'm going to say if in information giving, I suppose you can sort of check what they know. I think that's what he was really doing, guys. Check what they know. Are we asking questions or are we speaking ourselves in general, guys?
We need to ask questions. Yeah.
We need to if I'm giving information, am I asking questions or am I
Delivering answers more elaborately.
giving answers more elaborately? Well, if I'm giving information, guys, do I need to speak a lot or do I need to ask questions to the patient?
Well, we have to ask if they understand, if they're okay with what the information we are providing.
We do, that's a question. But who is giving the information? The patient or the medical
The
professional?
medical professional.
So who's going to be speaking, guys?
The medical
Medical profession.
Maybe 50-50.
Well, if I'm giving information, I need to get the information from here, Helen, right? I need to get that to them, right? So often we are speaking for a long time. If we're speaking for a long time, what do we need to do? Anyone? What do we need to do?
Check
We need
understanding.
to issue.
Rachel.
Yeah, we need to ensure if the patient are on the same page along with us.
I like that nice idiom. And Vlad, you say we need to
Check understanding.
Ranking also, yeah.
So this is what we're talking about. Now, guys, what is information giving? It's providing an explanation, or it might be advice. Okay. And we might check what they know beforehand, like Vlad did. And also, we might find ourselves speaking for a long time. When you're speaking for a long time, you must do this. I hope that's clear, guys. Okay. Now, next week we'll do information gathering, but today is information giving. What do OET say about this? So I want to ask Pratima, Pooja. Manuela said she can't talk. So Riri, what do OET specifically say about this? Riri, Juliana? Could you say hello? Don't be shy.
Hello?
Hello, Fatima. What do OET specifically say about this? Is it do they give more than criteria? Fatima?
Hello.
Yeah,
They do
Yeah.
give more than one. How many things? How about this, guys? How many things do OET say about this? Can anyone tell me how many things do OET say about this? 5 things, 4 things? What instructions? How many in sort of categories? Anyone? Diana, you think 5?
Yeah.
What do we think, guys? Is that correct? Is that correct? 5.
I think it's 3.
I think it's 3.
2, 3.
3.
Shall we look at the OET criteria? Shall we look?
Yes.
I think it's actually
Yes, please.
the 5 points they make. Okay, but it might be 3, might be less. I'm not sure. Let's have a look. I think I might be confusing it with gathering, which I did at the start. Okay, here it is. Information giving. How many things, guys? There's
5.
things. 5 things. Okay, so this is what OET say. OET. This is the OET criteria. And these are the 5 indicators. Carmen, what is an indicator, please? Can you tell me, what is an indicator?
It's like a signpost or something like that. It just told us how many they are.
Like a sign. That's a really good answer. Guys, it's like a signpost. It's showing information giving. Aishat, do you have a question? Aishat, go on, please. You just put your hand up, Aishat, and now you're not you're not talking. Okay, guys, this is like a signpost, okay? Now, what I want to do today, we're actually going to do information giving, not gathering. Sorry, guys. What I want to do today is understand these 5 things. 1, 2, 3, 4, 5. This language here is very, well, Zainab, is this language here clear?
Yes.
Are you Zainab, Carmen?
Oh, sorry.
Zainab, is this language here?
Yeah. What do you mean by clear? Like,
Is it understandable? Is it simple?
yeah.
Well, I'd say
No.
no, guys. This is for teachers. This is not for you. This language here is for English teachers. Presuming you guys are not English teachers, you might struggle with to understand what this actually means. So I would say no. What do we need to do therefore? Make it more simple. This is what I do every week. Let's make this more
Simplify.
Simplify.
So what does it mean, Helen, to simplify this?
To make it easy to understand.
And do we do this in OET writing as well?
Yes.
Yes.
Yeah, when we summarize in OET writing, we are often doing exactly the same thing. We're taking something that's a little bit complicated, reducing it down, making it clear. So this is what I want you guys to do today. You're going to go into groups, and I want you to discuss this with people like Carmen, people like Helen, Hussein if he's here, Vlad's getting pretty good. Discuss it with the more experienced people. What do these things mean? What is E1? Think of examples. What is E2? What is E3? Like that, okay? I'm going to give you guys 5 minutes. Is that okay, everyone? 5 minutes to discuss what these things mean.
Yeah.
Yeah? And as I said, if you're in a room with someone experienced who's done the exam before, right? Listen to them. They can teach you. A great way to learn things is to teach them. So Hussein, if you're in a group, please, I expect you to be doing some teaching here, okay? Guys, rooms are opening. And go into the rooms and discuss what do these things mean, okay? You will see something on your screen now. Please join the room and start the discussion, if that's okay. And I'll share this to the screen. Fantastic. Okay, so people are starting to join. I think most people have joined. If you have any problems, let me know now. Zugu, Mali, let me know if you've got any problems. Okay, if you're watching on YouTube, we do classes like this every day. People talking, questions, thinking about OET, trying to discuss the criteria. So check out www.set-english.com if you're interested in seeing more about our school. I think I'm going to finish the live stream now. Well, actually, I think I'll leave one extra bit on. Okay, so if you just wait 5 minutes, you will see. I'm going to give you 5 more minutes of this class free. All right, I think it's time to bring everyone back now. I'm going to make a quick message to them. Okay, guys, finish your discussions, and if you can come immediately now back to the main room, let's discuss what this really means, all of this stuff. All right, welcome back. Keep your microphones off, please, especially if you've got a noisy background. Fatima, I'm going to mute you. Please, it's very important, Fatima, because we can hear you all. We can hear you and your background. You've got to be turning your microphone on and off, okay? All right, so this is complicated. It's a bit jargony. What does that mean, guys? Jargony.
Something very specific for small amount
Formal
of
information.
communities.
Very
Yeah.
formal.
That's a good, Vlad, that's a good one. It's very formal. It's technical language, isn't it?
Yeah.
So when we're speaking,
Medical language.
yeah. Now, for me, when I'm trying to speak in a different language, I cannot really think about really, really complicated things. So what I do is I need to have something simple that I can remember. Let's try and create that now, guys. Let's try and simplify this. I'm going to ask for maybe if we can start, please, with Zainab, or if we try Uliana or Sumaya. Is it okay? So we're going to just simplify this today. Okay. Oops. And obviously, I've made a slight mistake with the topic today, but it doesn't matter. You know, E1 here. Can you see this? E1.
Yeah,
Can you read that? What does that say? Establishing.
establishing initially what the patient already knows.
So what does that mean really, Zainab? Can you make that really simple? What does that mean?
Establishing is starting.
If I'm establishing, that's a verb. What does it really mean to establish in OET? Come on, what are we doing? What's the action? Running, eating, playing? How do we establish? Everyone.
Building.
Asking.
We ask.
Determine.
We ask.
Checking, asking, yeah.
Well, determine is a bit technical. You ask. You ask. What did Vlad do? Do you guys remember Vlad's example? He was doing that, I think. He was doing E1. We ask. Now, Zainab, we ask what? What do we ask? Can you make it very simple?
We ask what the patient knows.
What they know. Okay. So simple, really, isn't it? We don't really need this word establish. So to do that, Vlad, can you give us an example again? If I maybe I'm.
How much do you know about diabetes?
Yeah,
Oh, let's talk about diabetes. What do you think? Something like
Let's
that.
keep it simple. Something like, how much do you know about blank, guys? Okay.
What do you know about?
And we'll talk more about this week because, Carmen, do I always need to ask them what they know?
Well, yeah, because you cannot presume that when they, for example, it's if a patient comes to you with dermatitis, you cannot presume that they know what it is. Maybe they know, but they don't know how to manage it, or maybe they don't know exactly what it is. So that's why is the reason why they are coming to you. So you have to make sure that what is their knowledge at that point. That's how I think.
I agree, but usually that's true. Remember, guys, we're explaining something usually. Okay. Now, what if you're explaining diet, Carmen? How much do you know about diet?
No, diet it's a different topic.
Starts to be a bit like that's not that even that question's not so bad, but we have to think, what are we explaining? Sometimes
disease.
sometimes E1 is so obvious and clear, you're not going to do it. Okay. It depends on the topic. It depends. And there's lots of things like this in OET. Sometimes you do it, sometimes you don't. This would be E1. But there are things that you must always do as well. Okay. We'll come back to this, Carmen. It's a good answer from you. So, Sibel, can you say hello, please? And can we have, or Rachel, or Pooja?
Yeah, hello.
Can you read this very long sentence? What is it? Pausing.
Pausing periodically when giving information, using the response to guide next step.
So this is E2. What does that mean? Can you make that very simple?
Like, oh, checking the patient understanding, like, is that clear so far? Or how does it sound?
Well, that would be E4, checking. You can see it's here already.
Oh,
But I know what you
basically-
mean. They're together, aren't they? E4 and E2 are basically the same. E2, though, is checking, understanding.
But maybe in the second one, we can check the patient's concerns. Like, do you have any further questions or do you need any clarification?
It's not that. What does pausing mean?
Like,
What does
stop for a while?
stopping? Guys, E2 is stopping. Don't just talk for 3 minutes. How do you know that the patient is understanding you? That's the idea. So you stop, you check understanding. You stop, you check understanding. You stop, you check like that. Okay. These two are connected. What about E3? Perhaps Sukaina can explain to us. What is E3? Can you make it really simple, Sukaina? Like, if you could put your microphone on, or Sumaya on Yeka, if you want to try this. E3.
For the E3, encouraging the patient to contribute to his reaction. So probably after a statement, you want to ask things like, how do you feel about it? Do you want to tell me, how
Yeah.
how
How do you feel about that? You feel right? Feelings, guys. How do you feel about that? Now, can we make it more simple? What are we doing, guys? Again, encouraging would probably be asking, wouldn't it? It's asking.
Asking feeling,
What are we asking?
feeling.
Feelings, reactions.
What about reaction, Helen? That's more difficult. What does reaction mean? How do
Like
you,
opinion, maybe.
what could you say to get the reaction?
How does it sound?
How does
How
that
does it sound?
Actually, I've come to
Or do you
realize.
think it's what you can do?
Say again?
Do you think it's what you can do?
Do you think this is something you can do? Yeah. Can
Yeah.
you cope with this? How does this sound? Do you I'll put that there, yeah. Do you think this is something you can do? I think anything where we're trying to get this reaction can be a good thing in E3. Checking understanding. Guys, what can we say? Riri, Rachel, give us a simple example. I talk, I stop. What do I say? What's a
For checking does I mean
clear?
Yeah, what can I say? Can anyone help her? Can anyone help her?
That clear so far?
Is
This
that
is the
clear?
classic.
Do
That's
you
clear.
have any questions?
are you able
Do
to
you
follow
want me
my
to
point?
repeat that?
Yeah, is that clear? Now I'm going to put a star here because we're going to talk more about this later.
Are you
Just-
able to follow my point?
Yes, it's things like this. Things like that. Oh, that's
Yeah.
not bad. Be careful though. I'm going to put a star here, and we're going to come back to E4 because E4 can be very difficult, and I'll explain why later. Okay. Last one, E5. Vlad, do you want to walk us through E5? What does that really mean? Can you read it first?
Discovering what further informations the patient need. So yeah, I think in the end we can say like, is anything else you would like to ask me?
So again, I want to emphasize this, guys. We're asking questions, okay? So we're asking to discover, to encourage, to establish. It just means to ask, okay? So we're going to ask. Sorry, Vlad. Finish this sentence.
Number.
Ask
Questions in the
summarize
Ask-
this. You can use the words, just reduce the amount of words.
ask any additional information. Yeah, additional information.
Right? This is fine. Don't doubt yourself. This is perfectly good, right? So we're going to ask for additional. We could say, how about if I say, I'm going to use the words from here. Further. Ask further information. Okay. Vlad, what would you say to ask for further information? What kind of things?
Is anything else you would like to ask me?
Is there anything else you would like to ask me? Guys, do you have any questions? Right? Is there anything else you would like to ask me? Do you have any questions? Helen, is there something nice that we can say here? Like, you can say, is there anything else you would like to?
Do you have any more questions so far?
Do you have any more questions? Anything else, guys? What else can we say?
Do you need any clarification?
Need any clarification?
Is
that's-
anything unclear?
Do you have any concern?
Any clarification? Do you have any concerns? Any of these will be fine, actually. You can also say this, guys. You can say, is that all clear? Or would you, have you heard this before? Like me to go through any of that again? You can kind of offer to to say it again if you want, okay? All right, so look, what are we trying to do? We're trying to just simplify this very technical. Fatima, Fatima, if that happens again, I'm gonna put you outside, okay? Keep microphones off, guys. So look, I'm simplifying this into something I think we can really start to remember this now, can't we? You can memorize this. But of course, you need to practice this. I'm not saying that after this class, you will be able to do this. Tomorrow you will practice. Wednesday you will practice. Thursday you will practice. And then Friday, performances. Today we're just understanding what is required. Okay? Does anyone have any doubts about this? Put your hands up if you have any doubts or concerns about this. Is it clear what we're saying? Been teaching OET a long time, so for me this is very, very clear, but maybe you have a doubt. Put your hand up, put your microphone on if you want to ask anything.
Yeah. Okay.
Yes, go on.
Sorry. Regarding the checking the understanding, is there any other words we can apart from clear?
There is. That's why I put the star, because we need to talk. So it's one of the most common mistakes. Okay. Vlad, do you have any questions?
Yeah, for me, 4 and 5 are quite familiar. So I mean, check and understanding is the same questions. Do you have any questions? And is that can be scored for both of them? I mean,
yeah. Well, I think this is like sort of stopping at the right time, and we'll talk about this now. Okay. Like just because you stop, it doesn't mean it's done at the right time. Okay. And then this one would be the language that you're using to check. Okay, let's go into this. So guys, if you remember at the start of the class, what did I say? We would talk about what is it, then make a diagram, and finally common errors. All of your questions are very good because you're basically asking me about common errors. Okay, now sorry if you're watching on YouTube, I'm going to say goodbye, or I've already done a lot more than I planned.